Thanks. My name's Madison. I'm here for OT. I'm going to get you up and moving today. I went ahead and looked at your chart and we're ready to go. Do you have any questions before we get started?
Yeah, my doctor put me on this medication. I think it's called Coumadin. And I don't really know why I'm taking it.
Okay, so on your chart here, it looks like you have a history of overclotting in your vessels. And before you were on a medication called heparin. Do you remember that medication?
Yeah, I was just confused as to why I changed it to Coumadin.
Yeah, so basically the heparin was just used to get your symptoms under control, but now that your blood is looking better, they put you on the Coumadin to use for a longer term. So when you go home, you don't have any of that clotting. So it's going to be to thin your blood, just like the heparin.
Okay.
Do you have any questions about the medication?
I was just wondering, because I was used to the heparin, are there any other side effects?
Yeah, so it's going to be similar side effects. So if you have more bleeding with cuts or anything like that and kind of easier bruising, that's probably to be expected. But if it gets anything that's severe and bleeding, that won't stop. And anything like dizziness or headaches or really severe stomach pain, you're going to want to tell me or your doctor.
Okay.
Yeah. And then the only other difference with the medication is with the Coumadin, you want to watch the amount of vitamin K that you eat, which we can talk about later in your plan of care when you go home about what your meals are going to look like.
Okay, so do they know that now? Are they monitoring that in the cafeteria?
They'll monitor that here for sure,
Okay.
knowing that you're on that medication, but when we go home, we want to make sure that we watch how much leafy greens and stuff like that you eat, so that the medication can have the best effects.
Okay.
Yeah. Okay, do you have any more questions or are you ready to get going?
I'm ready to get going.
Okay, awesome.
Thank you.